This is Free Medicine, Your
Oh my
Body, a
God, thank
Natural
you. Yeah.
Pharmacy. This is from Barnes and Noble, but Dr. Sodhi also mentioned you can get it on Amazon.
Yes.
And this is the look here. If you're on YouTube, you can see it, but if you're on audio, you can just head over to Barnes and Noble and type in Free Medicine, Your Body, a Natural Pharmacy.
These are a combination of herbs. Like we all know about saw palmetto, we all know about zinc, dim, selenium. These nourishes your bladder and your prostate.
Yeah.
And because basically, again, what we're doing, we're stopping those pathways which makes more estrogen kind of molecule, which is DHT. So it's not like, okay, my God, now I have a disease, I not run to the doctor.
Right.
You can use them preventive. And the good thing is they don't have toxicity. That is the best thing which we can say. And these herbs like Philanthus neruri flushes the bladder, flushes the kidneys, and flushes your prostate. And a lot of people out there has a low-grade prostate infection.
Welcome, everybody, to episode 191 of the Healthy Habit Podcast. I'm your host, Dr. Dayan of Healthy Habit Medical Center, and today we're talking with Dr. Virender Sodhi, back from last time we talked to him was in the 120s, it looks like, in 2024, so I'm excited they'll be here with us in 2025, talking all things Ayurveda and Ayush Herbs. Dr. Sodhi is an internationally respected Ayurvedic and naturopathic physician who's credited with evolving the understanding of Ayurvedic herbal medicine in the West. Dr. Sodhi became an Ayurvedic doctor in 1980 and worked as Ayurvedic medical professor until 86 before becoming the first Ayurvedic and naturopathic physician in the United States in 88. He's credited with founding Ayush Herbs and bringing Ayurvedic herbs to the United States. His experience with Ayurvedic and naturopathic medicines has resulted in extensive lecturing worldwide on these subjects, and he's the author of Ayurvedic Herbs, the comprehensive resource for Ayurvedic healing solutions. And Dr. Sodhi is currently practicing at the Ayurvedic and Naturopathic Medical Clinic in Bellevue, Washington, and he focuses specifically on oncology mainly. But today we're going to be highlighting men's health, libido, prostate health, and just overall energy levels, which I've lost count, Dr. Sodhi, on how many men present to our clinic with prostate issues and chronic prostate problems, or BPH, and things of that nature. It's unbelievable how common it is here in North America. So welcome back, Dr. Sodhi.
Thank you very much, and really appreciate Dr. Ryu having me on Healthy Habits. Our relationship goes many, many, many years back.
Yeah.
And I have come to your store and even broadcasted from the store. You know, it's a fun to watch that things grow, and I'm very excited too. And just to let you know, that's my second book, just published.
Okay.
Published, fresh from the press, and it's the so first book was like my PhD thesis, my anger towards allopathic medicine. They said there is no evidence that Ayurvedic medicine work, so I published a lot of research papers too. But this book is my to connect to my population, very low language kind of stuff, you know, that not very technical language. And simple language. So the title is Free Medicine, Your Body is Your Natural Medicine. It's available on Amazon. Again, the Free Medicine, Your Body is Your Natural Pharmacy. Because everything we need, body makes it on demand.
And I'm taking a note on that, Dr. Sodhi, because I'll be sharing that here in the description box below the video. And again, that's called Free Medicine, Your Body is Your Natural Pharmacy.
That's right.
Well, congratulations on that, my friend. That's an important book. Absolutely. We need people to know that this is older than any modern system of medicine we have right now. This goes back thousands and thousands of years, correct, Ayurveda?
That's very true. Very true.
So, perfect. And then in today's topic, we're going to highlight, why is men's health an important topic in the first place? What are some of the biggest misconceptions about men's wellness, Dr. Sodhi?
So I think if we look at the men's health, I think we are in a bigger crisis right now. If you look at the sperm count of my great-grandfathers, they were around 100 times more sperm count in my grandfather's times. Now we have dwindled down 100 times less. So look at the quality of the sperm quality we're producing, and no wonder why there is the infertility issues all around the world, not only in USA, it's happening everywhere in the world. And if you see any educated, higher educated culture, the birth rate has dropped drastically, very, very drastically, very drastic. So I think there is a huge need for us to look into that what we can do to get the best sperm quality, because sperm quality is a genetic materials, okay?
Mm,
And if your
yeah.
genetic material start to deteriorate, so the seed, one seed has the potential to give zillions of seeds further. And that's also applies to females too. I'm not only talking about male here, but we know the endocrine disruptors and plastics and all those kind of stuff. We are just in a mess. We
Right.
are in a very, very bad mess. And these plastics and these endocrine disruptors, they sit on the receptors and doesn't allow them to function properly. And that's why what we have to do, we have to go to the mother nature to find the answer, real answer. And that's what Ayurvedic medicine is, just learning from the mother nature.
Right. And a lot of men, they tend to act very slow when it comes to their health. So this is going to
Oh
be
my
a
God.
good reminder, right? A lot of
Exactly.
times the wife brings them in, or their girlfriend, after she's
Yes.
already been seeing the doctor, then she brings the husband. So
10
talk about that a
years,
little.
10 years, 10 years. I have a wife coming to me 10 years, and then the wife, the
See,
husband would be dragged into it.
there
So,
you go.
come on, listen, need to get help. That's very common. Male thinks like a macho and strong man. Okay, I cannot get sick.
Exactly.
That's the very wrong thought process.
Uh-huh.
We all need to be checked out. And if you have a health issue, discuss about it with your
Right.
physician. And I think I like naturopathic medicine. I'm a naturopath myself, and our community can do remarkably good job for a lot of these folks out there.
Amazing. So when it comes to prostate health, libido, what's going on there? Why is it such a huge thing here in North America? Really across the world, it's spreading now. It's becoming, the whole world's becoming more westernized, Dr. Sodhi. Why is the prostate such a common part of the body that's affected in the men?
So I think as you have to go back to the way we are living in the society now.
Yeah.
Stress level is high. So if you go back to your steroidogenic pathways, where the cholesterol is the molecule which makes any hormone in the body, and what happened then? There's a two pathways: the anabolic and catabolic. The catabolic makes your cortisols, and anabolic make your testosterone and estrogens and all this kind of stuff. So when you go under stressful situations, you're making more cortisol. So your anabolic pathways get shifted. So your body is thinking, okay, I need to make more cortisol so I can make this guy live. And this disturbs every pathway in your body. And then on top of it, you're eating like the standard American diet, which is awful. So many chemicals, so many preservatives, so many endocrine disruptors. You are going to tilt it so much further. So basically, first is thing is watch out for your stress. Stress is going to be there. I don't think there is any way we can reduce the stress because we're living in a society. But we need to adapt to a lifestyle where we every second we live in a moment. So shift, and start living in a moment rather than, oh my God, what's going on in my head, and then live with that one. So meditation, yoga, breathing exercise, all those things, the Tai Chi, anything which you like to do, music, art, having a gut laugh with your family friend will get rid of your stress.
Yeah.
Then you want to work on, you look at your diet. And again, eating more real food. Any food which comes in a package is not a real food. It can be organic, it can be natural, it can be all those kind of label, but that's not the real food. Real food is what comes out of the ground, which grows in the trees, which grows on the vine,
Hmm.
which flows in the water, all the animals, birds, which is on the earth. So those are our real food. So we need to come back to those old habits of eating real food. If we don't, we are going to just get stuck in that rut, and we are never going to make our hormones better. So very important. And the prostate is directly attached to that one, because what happens
Mm.
when we are eating the food which we should not eat, and your body's pathways are changed, and you're making more estrogen, because of the reason, because the testosterone turns into 5-DHT, and 5-DHT mimics the your estrogen kind of molecule. And now what happened, the prostate can start enlarging. and uh,
Oh,
we just think about the prostate is the size of a walnut, and then the pipe going through it, which is your urethra where you pee out. And now what happened is, if the prostate enlarges inside, it kind of got the squeeze on
yeah.
the that urethra, but if grows outside, so then it does not cause that squeeze. So this is an interesting phenomena
Uh-huh.
which we need to understand. So, but a lot of people has the growth of the prostate inside. And you see that,
Mm.
you're not able to urinate properly. You make a bifurcation of urine. The urine comes in dribbles, or you have to have too many times to go to the bathroom. Has a hard time. We call hesitation of urination. You go to the bathroom, it takes forever to start the urine, and then stop it because you may dribble, dribble, dribble. So these are the alarming signs when we need to go to your doctor and see evaluated. And the test is not fun, by the way. It's a rectal test. You check
Yeah.
it out, and but it's essential to see out what's going on. And sometimes ultrasound, and sometimes depending upon what's going on, you may need an MRI to see it. But once you have those, then get it checked out. And then after that, we have so many things which can be done. Of course, when you start eating diet in fiber rich, which is your vegetables. If you eat a lot of crucifer vegetables, broccoli, cauliflower, mustard, kale, chard, turnips, radishes, these are all mustard family. We are blessed to have that in our life. These vegetables are amazing. They have a lot of rich fiber in them. They have a lot of wonderful phytochemicals like a sulforaphanes, and really amazing, amazing. Many others which I may not be able to pronounce all of them because
Right.
some of them are tongue twisting names,
Uh-huh.
but they are amazing. But basically, what you need to understand, Mother Nature has already taken care of us. We just need to follow the laws of Mother Nature. And when you eat what is available in that season. So my theory is that when we eat food in the season, we have those genetic markers on them. That genetic markers feeds into our epigenetics markers and then switches on, switches off,
Yeah.
and we are now in sync with the Mother Nature. Just to give you an example, like we have the animals, dogs or cats. So you might have seen that as the dogs comes in winter season, they grow extra amount of fur in them, and in summer they shed off. If you have a German Shepherd ever, you know what that means. You have wool of that German Shepherd all over the house. So that
Yeah.
is basically the Mother Nature has known to create that responsible behavior in us so that body cannot freeze to death in winter, and in summer it doesn't need that extra wool, so it sheds off. So basically what we need to do is live in accordance to the laws of Mother Nature, and that's my book all about, is like a free medicine. We everything we make on demand, but what we need to do is follow the laws of Mother Nature. And we have the Ayush Herbs has made a product called Prostate Health,
Uh-huh.
and it is available only on ayush.com, not on any place right now. But it's amazing, with a lot of research. And I've been practicing for 45 years now and seeing thousands of patients. And these all the products which we manufacture at Ayush Herbs, goes through a kind of rigorous clinical experience before we even launch it. And of course, I am been studying herbs for ever, almost 50 years,
Wow.
and it's my passion to know herbs inside out. And then we have a wonderful team, Dr. Shalander, Dr. Anju, Dr. Tejinder, and they happen to be my relatives, brothers and sister-in-law, and also Dr. Brian Keenan. And then we have many other who actually PhD scientists who join us to help and make that product the best what we make.
Yeah, you guys are helping a lot of people, and like you said, 45 years of experience in this field. So, folks that are listening to this, especially men, if you're a female listening with a man in your life or someone that you care about, they need to listen to this episode 2, 3 times. This is dense with information. You covered screening, Dr. Sodhi. You covered the why the prostate is behaving like this in the Western world. The different types of growth of the prostate. It can be on the outer capsule of the prostate, or it can be on the inner, squeezing that urethra, making it difficult to void urine. And you covered much more, the MRIs, the ultrasound. So this is incredibly important. And now we're going to dive into that herbal and nutritional support here. I'm going to do a quick screen share. I want people to also see a visual of your book, Dr. Sodhi. And this is your second book, correct?
Yes.
This is Free Medicine, Your
Oh my
Body, a
God. Thank you.
Natural
Yeah.
Pharmacy. This is from Barnes and Noble, but Dr. Sodhi also mentioned you can get it on Amazon.
Yes.
And this is the look here. If you're on YouTube, you can see it, but if you're on audio, you can just head over to Barnes and Noble and type in Free Medicine, your body a natural pharmacy. And here's from Ayush.com. We have the prostate formula here, brand new product, not available yet in stores, but you can get it from Ayush.com. In the meantime, we'll be keeping people updated if we end up carrying it here at Healthy Habit. For the men out there who are interested in this, holistic male support. Tell us specifically about this product, Dr. Sodhi. Let's dive deep on this one.
So basically, these are a combination of herbs. Like we all know about saw palmetto, we all know about zinc, dim, selenium. These nourishes your bladder and your prostate.
Yeah.
And because basically, again, what we're doing, we're stopping those pathways which makes more estrogen kind of molecule, which is DHT, and then allowing the urine to flow properly. And I have so many. I'm 67 years old, going to be 68 this year, and I still urinate properly because one of the things is which I do, I take this formula on a regular time because you don't want to wait until you hit that. You want to be preventive, and Ayurvedic medicine is a preventive medicine. So it's not like, okay, my God, now I have a disease, I now run to the doctor.
Right.
You can use them preventive, and the good thing is they don't have toxicity. That is the best thing which we can say. And these herbs like Philanthus neruri flushes the bladder, flushes the kidneys, and flushes your prostate. And a lot of people out there has a low-grade prostate infection. Very, very low grade. And that also enhances because now you have inflamed prostate, which gets swollen up. And then the hormones, which are not properly working there, because if you have normal amount of testosterone, real testosterone, your prostate will be healthy. But we have not a normal amount of prostate. That's why when people take testosterone, they have to take a estrogen blocker because it converts into estrogen along with it. So, but basically, we're doing it with the herbal tone of it and getting your prostate in the best shape. And the best thing is, like any medication, drug you take, there is a side effect to it. And they come with a very little, so I call them food grade side effect. Like if you eat too much cayenne pepper, it's gonna give you burning a little bit.
Yeah.
So that is all manageable. We can say, okay, I need to just tone it down, and I will be very, very good with it. So basically, there is all those things which we can do, and I take one a day on a regular basis, and I don't have to wake up. One of the very frequent symptom which people notice when they have prostate issue, they have to wake up a couple of times at night, and that disturbs your sleep. And I love my sleep, and I don't wake up.
That's unbelievable. Good for that's so rare. That's so
exactly.
good
I don't wake up at all. I go to hit the bed by 10 o'clock. So again, to talk about the natural clock, because that's very important. When you're not meeting the natural clock of the body with the biorhythms and the circadian rhythm, you are going to make more cortisol. When you make more cortisol, all your hormone balance go off to the, somewhere else. And then you're not going to be very, very perfect with your circadian rhythm. So these herbs, the shatavar is actually also a female herb, by the way, but it's also a male herb because it helps your prostate to nourish it. And then tribulus, which is a diuretic, but also it promotes your natural testosterone. So again, we are not here against testosterone. So a lot of time when people take extra amount of testosterone, their prostate get enlarged, by the way.
Yes.
So, but this is again very different. And then we have the DIM, which actually also makes your the estrogen pathways. It pushes into the other side, doesn't allow them to go towards the estrogen pathway.
Right.
Boron, again, boron is amazingly what if you check males. They have a lot of estrone, which is another form of estrogen. There are three kinds of estrone, which we know, but there are many other, but three mainly we talk about: estriol, estrone, and estradiol. So when you're making too much estrone, it also affects your prostate. So boron actually puts a damper on it. It actually stops it. And this is very small amount, and but helps it. And selenium, again, is a wonderful thing, is a wonderful antioxidant for many things, but it's a preventive of the cancer. Selenium has been studied for a lot of different things, but basically, again, we are nourishing the gland. When we nourish the gland, the functionality of that gland gets normal, and we are having the best results with it.
Incredible breakdown, Dr. Sodhi. I like that you mentioned the DIM and the tribulus combination there, because a lot of men, they've been told by the conventional doctor, oh, you can't get anywhere near testosterone. Avoid anything that can raise testosterone because it's bad for the prostate. I think that's too simple of a way to look at it, correct? We need testosterone in the male body, right?
Yeah, actually, unfortunately, everybody after the age 30, they start to decline testosterone
Yeah.
every, decade, every year. Actually, I think there's a 2%, I think if the research is 2%
Yeah.
drop every year. And by the age you come to my age, 67, there'll be zero left in them. But I try to maintain my testosterone. I don't take, by the way, any the extra testosterone because I don't like it personally.
Right.
I don't write prescription for testosterone, by the way. I may have few patients on it, but what I use the herbs again, the like a Shilajit, Ashwagandha, Mucuna pruriens. We have all those products, wonderful products, the Mucuna Plus, Shilajit, Ashwagandha. We also have AyuTest, which has
Uh-huh.
shown. I have patients who has a testosterone of 70. And when we give them, they go to 500 to 600 testosterone in 3 to 6 months. It takes time. It
Uh-huh.
doesn't happen, so these all products are amazing help. So these are in Ayurvedic medicine. We have a special branch which is called Baji Karn. So, like we talk about medicine, surgery, ENT, gynae, obstetric, psychiatry. So these branches were there thousands of years ago in
Yeah.
Ayurvedic medicine too. And one of them was called Rasayan. Rasayan was to make your immune system stronger. So there was a full, like we are talking about anti-aging these days. And there was a Bajikarn. Bajikarn was because as we age, the hormone decline in male and female both.
Yeah.
So what happened is if you strengthen the hormones of the body, you live longer, your quality of life is better, you get less diseases or no diseases. We all die, there is no way out of it, but it doesn't mean that we have to die miserably.
Uh-huh.
So like one of my patients just died recently at the age of 97. If that is not impressive,
Yeah.
he has done 3 PhDs. He has 107 patents on his name. He was walking 7 miles one day before his death.
Yeah. And you can see here average is 77. Uh,
Exactly.
so he's going 20 years above average right there. That's
And not,
incredible.
not only 20 years, because a lot of people may be living in America in nursing homes.
Yeah.
Look at the quality of life. This guy was walking 6 to 7 miles a day. And actually, I'm going to write up on him because he's such a inspirational person, and he has so many patents on his name. And wonderful, wonderful soul. So I think one of the things which we need to learn, yes, we all die. There is no way out of it.
Yeah.
But the quality of life, why we are brought in here. I think this is a little spiritual question. What is my purpose?
Yeah.
What I'm doing on this earth? Is I'm just going to be eating and fooling around and then go, or I'm going to make some
Yeah.
impact.
Yeah.
And it can be small impact, by the way. Like I think the biggest impact which we need to make in the society is start eating the real food.
Unbelievable. I like this IU test. Dr. Sodhi, we're gonna have you on again, so I'm excited. This is
Sure.
only the first of our discussions this year. It's going to be a good year. Overall men's hormone and health support, and this was different from what we were just looking at with the prostate formula. This
That's right.
blend was formulated using the latest botanical research in order to discern a perfect combination for promoting healthy testosterone levels, prostatic function, and overall endocrine function. And I like that you mentioned you don't use necessarily the straight up testosterone hormone. That can be a little bit too intense. You're
Yep.
getting it from the herbs,
Yep.
correct? Which is more delicate, more gentle on the body. It's way less risk of side effects, less
Yes.
likely to irritate the prostate, correct?
Yes. It's like as I take this herb myself,
Yeah.
and because the maintenance of hormones are very important for all of us, and so my hormones are around 600. Some doctor wants it at 800, but I'm
Right.
67 years
It's
old.
incredible.
So
Unbelievable.
that is a good number without any getting any hormone
It's a
support.
great number.
A great number, exactly. And I see young people, 25 years age, 20 to 30 years of age, their testosterone 70 because
Yeah.
they are IT professional. They are really working very hard, very crazily, many, many
Yeah.
hours. And they have so much because cortisols. So again, we are making your anabolic pathways go crazy. And so when we give them, and I will tell you, doctor, that there are so many patients who were not able to father the kids after our treatment. 6 to 9 months later they became daddies. Okay, and it gives me so much joy when I see those kids coming to my clinic. It is a wonderful thing. And
Yeah.
the other thing is when you give testosterone, you become sterile. Doctor, that just the testosterone, the exogenous testosterone make you sterile, so you cannot make babies if
Yeah.
you have a extra amount of testosterone as a medicine. But these will not do that. This will
Interesting.
help
Yeah.
amazingly, making the good sperm quality, sperm count, motility. Because there are so many factors when people don't have they can't produce the babies, because it can be sperm count, it can the quality of the sperm, it can the motility, how good swimmers those sperms are. There is a huge competition between these sperms too. There are
Yes.
millions
Yeah.
of
Yeah.
them which is ejaculated by a male, but then one of them are able to go up in there. So, but this is all very interesting. If you read this, it's an amazing phenomena of the mother nature.
Amazing, Dr. Sodhi. And even saffron is included into this formula, it looks like,
Exactly.
which
Yeah.
is
Yeah.
important because you need testosterone for mental health too, and clarity
Exactly.
and feelings of well-being. And saffron's classically been used as an antidepressant. I want to hear your thoughts though, and we'll finish off on that note on why saffron was included into a testosterone formula.
So, it's a historical use, like saffron been used in the Indian culture, in Chinese culture, in Persian culture for centuries and centuries. And I want to interestingly give you a little story.
Please.
So when people turn into like spiritual, they wore a saffron robes, and that was soaked in saffron in older. That's why they call saffron robes. So basically, saffron has a very calming effect. It also increases your testosterone.
Wow.
And interestingly, in females, it increases their estrogen level by even smelling the saffron. The aroma of saffron raises the estrogen in female and testosterone in male. So the mother nature, I think, is so amazing. That amazes me every time that there are two different actions done by the same herb, because depending upon who is taking it. And that
Wow.
can only happen in mother nature.
Thank you for highlighting that. I'm excited for our next discussion, Dr. Sodhi. Thank you for the whole team there, Brian, your brother, Dr. Shailender Sodhi, and the whole team there at Ayush and Ayurveda. You guys are doing incredible things. And what's a good contact for now? They can go to ayush.com. Is that good for now?
That's right. Ayush.com. They can go there, and any questions they have they can post it there. We are in constant change. As you know, the technology changes. I'm not the technology guy, so don't ask me. But
Okay.
we have good people there who
Yeah, yeah.
help us. And very, very wonderful team. And I'm very proud of including you. You're amazing too.
Thank you,
And
buddy.
you're a graduate from Sonoran, and I love Sonoran. We just
Uh-huh.
go there, lecture everybody. Now, actually, one of our friends is going to be the president of the college. So
Really?
very exciting.
Oh, that's amazing. Yeah,
Yeah,
good.
Lisa Ash Schuler is
Okay.
actually is a Shrinder's classmate, by the way. So
Phenomenal. And so, yeah, we look forward to you when you come to Phoenix as well here at the store. Our customers are asking, when are the Dr. Sodis coming back? Any
love
plans
to.
on that in the near future for 2025?
Yeah, love to. Yeah, we will. The time will tell, but
Okay.
certainly we'll love to. Let's pencil sometime somewhere.
Okay. Thank you
Okay.
for your time, Dr. Sodhi. Give my best to Dr. Shailender as well, and I look forward to our next one.
Thank you very much.